There's a bunch of new research, a bunch of new papers that have come out detailing ways that artificial intelligence, things like ChatGPT and all that stuff, are interacting with medical research and dealing with patients and all those things. One of these, groundbreaking new AI can detect cancer earlier. This is from the New York Post. Doctors and scientists in the UK have reached a major breakthrough in fast-tracking cancer detection, all with the help of AI. The new artificially intelligent algorithm in development since 2020 has the means to determine whether or not abnormal growths found on CT scans are cancerous, The Guardian has reported. Lungs of 500 patients were analyzed in a published study on the impressive technology. Quote, according to these initial results, our model appears to identify cancerous large lung nodules accurately, unquote, said the researcher Dr. Benjamin Hunter, a clinical oncology registrar at the Royal Marsden National Health Service. Quote, next we plan to test the technology on patients with large lung nodules in clinic to see if it can accurately predict the risk of lung cancer. If successes continue, this will also streamline the time it takes doctors to make critical decisions on proceeding with treatment, particularly with growths that are medium risk, according to the outlet. This, and then later on, I saw in another place where they were talking about this same study that doctors doing this research, looking at the large nodules in lungs, whatever it was, that their an accuracy of 1 would be a perfect prediction every single time. And they were saying that 0.5 is random, like just
50,
flipping
50.
a coin. Right, exactly. And that trained doctors had an accuracy of 0.67. So better than random, but not exactly great.
They were using the Brock score for that.
Right.
Yeah.
But that this AI, once it was trained, was able to detect it with 0.87 accuracy. So 87% correct, I guess, which that's incredible. That's amazing. So this is specifically about lung cancer. Why, I don't fully know what's the deal with large lung nodules and stuff. It was saying that some of them are cancerous and some are not.
Yeah, we could touch on some of that. Don't want to go too deep. But yeah, right. I think the key thing on the question you're asking is, well, this was done in the UK. So the data point that I pulled just kind of stuck to the UK to stick, in this article. But 60% of lung cancers that are identified are in stage 3 or 4. Mm-hmm. So that essentially means it's spread to some extent. So
okay.
That's what's very critical about this, is that I don't know what the term should be, but they didn't go for an easy cancer to detect or to treat. And they went for one that has a lot of ambiguity because, again, what you've already mentioned, that small lung nodules are very common. Most are benign. So essentially 1 out of every 500 CT scans done for whatever reason show pulmonary nodules. And 50% of smokers over 50 have one.
That makes sense.
They're mostly, when they're small, they're very common and they're mostly benign. But that's again where the complication becomes. You don't want to overtreat something
that's benign.
Yes, but something as serious as lung cancer, because you're either radiating it, you're giving chemotherapy medications, you're giving heavy duty things, you're even biopsying it, potentially even something like that, are all very invasive, all very quote unquote harsh treatments. So over treatment is a big fear here, but obviously under treatment,
it's a problem fatal. Too. Yeah.
So
they're saying that by the time doctors are certain that, this is definitely cancerous, that it's you said stage 3 and 4 a lot of times.
Yes.
And so something like this can detect it earlier and more accurately predict what actually needs treatment.
And again, the exact specifics is beyond the scope of this, but I still wanted to know exactly how, why this AI or how it actually worked. And just in a general sense, they use what's called radiomics. Okay. So essentially they fed into the AI a huge number of images.
Right.
And labeled them as cancerous or not, their size, their shape, do they have ridges, all those things. Mm-hmm. And they fed it all that data so that's how it's looking at a new one and kind of lining up what they believe it to be based on all that data. So there's different scores that doctors can use. They're obviously very well trained.
Yeah.
But I think when you're looking at something that like this, I do totally now, even just with that broad brush description, understand how it works and understand how it could be beneficial.
Right.
It's not determining treatments. It's still, essentially just another tool for the physician to, make their decision and to choose treatment. But in terms of determining the likelihood of it being cancerous, that does totally make sense to me in that broad stroke.
So I found out about this stuff because it's a very long story, but the short version is I was selling a record to a guy and just chit-chatting, and he said he works in data science in the medical field, and his job is in a dermatology, I believe it was, teaching AI to recognize potentially cancerous like moles or something like that.
Yeah.
And it's the same sort of thing.
I was going to say, it sounds just like that.
It's just feeding it thousands and thousands of images and helping the AI to know this one was cancerous, this one wasn't. Yeah. And then now it feeds it a new one, and you ask the AI, hey, is it or not? And it's able to spit out a relatively accurate answer.
Yes.
Fascinating stuff. And a really cool application for something like that. When it comes to cancer, you mentioned radiology and all of that. Is there anything else that for our purposes are worth talking about in terms of touching on for pharmacology?
Yeah, I think maybe it would be beneficial, just to, wrap up lung cancer this way and potentially
since
open
we're
it
here.
up as since we're here. Yeah. So, like Joey mentioned, it is unfortunately one of the forms of cancers that are seemingly caught later in its development. And to sort of piggyback on that, the average age at diagnosis is around 70 years old. So again, it's later in life, it's typically later in staging, and therefore, tougher to treat oftentimes.
Yeah.
And so the pharmacologic treatments will then depend on the specific form that you're dealing with, and then also sort of the staging system that's used for, across the board for different cancers. And as always with different forms, surgical resection can be an option, chemotherapy, of course, radiation, and then sort of the gold standard, depending on where you fall in the staging system, combination or multimodal therapy is used.
Right.
And so as far as classifying lung cancer, broadly speaking, you're looking at non-small cell lung cancer and small cell lung cancer, I think, are the two biggest distinguishing, branches of it. So the non-small cell form is arguably the most common. There are additional subtypes from there, but we'll, stay pretty broad here in this conversation.
Yeah.
And typically you'll see drugs that are in the platinum-based family, so cisplatin, carboplatin, those medications that,
Platin?
Yes.
Not platinum.
So they're technically platinum-based.
Really?
But then they have platin.
Like
nomenclature.
The actual
Yeah.
metal?
Yes. So that's, I think it resembles the actual molecular structure is of platinum, derivation or whatever. But
fascinating.
And those medications work basically just by, and a lot of these work this way, trying to kill cells,
right.
To induce cell death by messing somewhere with how DNA repairs itself, how DNA is made, DNA synthesis. I'll just list some of the classes. And again, just more or less to say, hey, these might resonate with a family member who has lung cancer or other forms of cancer, because these drugs, these chemotherapeutics are not necessarily specific to lung cancer.
Sure.
So there are vinca alkaloids that are used, anti-metabolites, taxanes, and then there are some new immunotherapy, monoclonal antibodies that are used these days in maybe I would say later developing lung cancers, like later staging. Opdivo and Yervoy, I think it's Yervoy or Uvozy, whatever. Those are two of the bigger ones for non-small cell lung cancer. And then to gloss over small cell as well, this is typically viewed as the more aggressive form of lung cancer. There's generally no role for surgical resection in these cases because it's rapidly spreading. And so you'll see, more aggressive radiation, more aggressive chemotherapy to start. And to shed light on the severity and the magnitude of that one, there's roughly a 5% 5-year survival if diagnosed with small cell. So,
wow.
Definitely a very clear link here to smoking as well. And again, treatment is predicated on whether it's very limited involvement throughout the body or extensive staging where it's
Spread.
already spread more aggressively.
So the first thing people should do is stop smoking, right?
Tough, but yes, definitely not helpful here to continue to smoke, unfortunately.
All right. Well, very cool. So this is great news that we are using AI to help identify these things faster.
I was going to say, so to kind of sum that up, it's earlier detection potentially just kind of gets the ball rolling for treatment is kind of the way I interpreted it. And, because even if it is suspected, if cancer is suspected, there's so many additional lines of testing that need done to confirm that. Yeah. And if these models are so effectively predicting this, then it's like, you might be able to skip some of those intermediary steps.
It's one of them to get the one type of score, the Herter score. You have to use a radio tracer. So that's an entirely separate procedure. And, so you can, they're not at the point yet, but obviously like Dante's saying, if you get there where you can really trust the accuracy in large scale trials moving forward, then that's where the streamlining comes in. Definitely.
So is this, realistically, are we looking at a situation where in 10, 20, 30 years, we just have a routine scan of our lungs done and the AI can relatively accurately say, hey, you should go have some further testing because this is a real problem here.
Yeah.
I guess theoretically.
And I think I never want to come across as being potentially on the side of being against evidence-based medicine. That's crazy. Obviously, the good that comes with evidence-based medicine outweighs any potential bad. But I think the more you get into where decisions are taken out of doctors and not just doctors' hands, but a doctor-patient decision together,
right?
That's where it gets a little scary for me. Because then if you say, hey, sorry, Mrs. Jones, I put it through the test, and every other doctor is going to say you have to do this now and not maybe take into other potential issues, quality of life, how old is this person, et cetera. What other, what are their feelings on it? I always just get a little... I don't know. So anything that's going to push us further away from a doctor decision or a doctor-patient decision, it's not even close to being there. If that's where we go, you kind of brought it up.
Right.
That's what I had in my little concern section is something like that,
See, the AI is a threat.
As far like the general theme with what we're going to talk about for the rest of this conversation kind of is basically the concerns that Joey brings up there.
Yeah.
You know what I mean? Is that even the critiques of physicians looking at these studies say those same things. You know what I mean? There's ultimately in whatever fashion the machine learning or deep learning or whatever's being used, there's going to be no way to substitute the actual clinical decision-making process that goes between patient and physician provider.
Right.
So it's tough to. It's easy because we're going to see a lot of compelling studies, a lot of compelling things that put more eggs in the AI basket, which is great, but it has to be viewed as no more than a very promising tool, because it is easy to go too far.
Yeah.
I forget the term, but there's the deep learning AI, and then there's a more passive AI that just uses what's been entered into it.
Yes.
And the deep learning AI is the one that can be a little more scientifically incredible sound.
It's more human-like.
Yeah.
Right.
But if it starts deep learning and starts maybe using some of its own decision making, like, well, this is his lung and I don't care about anything else,
right,
or how bad these chemo treatments will be. My job is to fix his lung. So I'm upping this percentage. I know that's getting a little out there, but those are the things that you do worry about if it goes into this deep learning where it's starting to make human-like decisions And
it should be noted for our purposes, I'm sure there's some data scientists out there that are screaming at their radios right now. We're saying AI in the colloquial sense. There are variations on all of this. There's the large language models, there's the deep learning stuff, there's all those variations, and they're not all the same, and they all operate very differently. And many people would argue that they're not even AI, but
Yes.
for our purposes,
Something as simple as whenever you're typing into Google and
Yeah.
it starts, recommending the rest of your search query.
Yeah.
Like even that's
Predictive
technically,
text, yeah.
considered AI. So yeah, a lot of it is, seemingly pretty mild,
But to this kid who grew up in the 80s and 90s, it's all science fiction, and it blows my mind every time.
yeah.